So we know as we get older, we face innumerable challenges. And one of them is your heart can sometimes turn on you, that the efficiency of the valves just aren't the same. And there hasn't been a lot of things that we could do. You can do the valve replacement therapy, but boy, it can be so intrusive. Apparently, Henry Ford Hospital has a device now that can correct a lot of these things.
Yes, Guy. The Henry Ford Structural Heart Team came to the rescue of an 85-year-old man from Beverly Hills, Michigan, who suffered from tricuspid valve regurgitation. Now, that's when your heart valves leaflets don't close all the way, and some blood may flow backward through your valve, making your heart work harder. Tricuspid regurgitation has a close correlation to the aging population. It is estimated that there were 213 million heart valve patients worldwide in 2019, resulting in 2.6 million deaths annually. Henry Ford interventional cardiologist Dr. Pedro Engel Gonzalez successfully implanted a new investigational heart device called the K-Clip into Frank Konjarevich, who was the first patient in North America to receive this device.
We go through catheters, through special tubes, through the veins. In Mr. Konjarevich's particular case, we actually were able to go through one of the small veins in the neck with special tubes, catheters, and that's how we get to our target area, the particular area of the heart that we want to treat, and we can do it all through these catheters without having to do any incisions, without having to do any open heart surgery, without having to put someone on a heart-lung machine. We do it with a beating heart. And the important thing is that people recover much faster. You know, after it's done under general anesthesia, but after they wake up from the general anesthesia, after 2 or 4 hours, they can be walking around their room, even going to the bathroom by themselves. And in Mr. Konjarevich's case, he actually went home the following day.
Mr. Konjarevich says through testing, he found out he had this leaky valve and was not too keen on getting this procedure done.
It was a painless operation, and like I say, I was up the next morning, nothing ever happened. This team, they were remarkable. Everything they did for me and encouraged me to do this, and I didn't really want to have it done, but they brought me to my senses.
Diane Tapp is Mr. Konjarevich's daughter. She said the family helped her dad make the decision to get the procedure, and hopefully his procedure will help save future lives of those suffering from tricuspid valve regurgitation.
I'm so proud of him to be brave. He was going through a lot of other medical issues at the same time, so it kind of clouded everything that was going on, but I'm glad that he took, our advice and the advice of the team here to do that, because that is one thing. It's going to help other people, and with this information going to the FDA and get more approval for more people to try this, it's just a new, really cool way to fix the valve.
Now, while the K-Clip has not yet been approved by the FDA, Mr. Konjarevich was able to receive the investigational device through the FDA's compassionate use pathway. And previously, Guy, the device had only been available to patients in China.
Right. So more groundbreaking stuff coming from a number of these hospitals. Can't give them enough credit for that.